CMS is conducting these audits twofold. One, when it's on Medicare, they are looking to make sure that you really met all the aspects of meaningful use, diving into each measure and making sure that you have met it. On the Medicaid audits, it's more about auditing your state's Medicaid program to make sure that they correctly validated your volume metrics and your documentation on adopting, implementing, and updating. The thing that every healthcare system and physician office should be prepared for in a meaningful use audit is to make sure that they have all their documentation lined up. And you should really be thinking about that before you attest, rather than waiting for the audit. But once you get the audit letter, you're going to have a very short time frame to respond. And it's better to be prepared and to give them as much information as you can on the first pass. And I would also say that you need to make sure that you are able to reproduce data out of your systems going back at least 6 years. So you need to be very careful about how much data you may store or how much archiving you may do of data so that you can respond to these audits when they come along. The audits were quite extensive and took many months, with 2 or 3 further requests after the initial submission for more data. In the case of the Medicaid audit, it went on for at least 9 months before we were able to get the notice that we had met all the criteria. For the Medicare audit, it didn't take that long, only about 3 months to get the determination. But in both cases, just when you think you're done, they come back and ask you for more, and it's usually more detailed information about one of the aspects of meaningful use. One surprise was we knew we had to have the documentation on how we'd created our volumes for Medicaid. But in the end, they ended up wanting actually all our detailed claims for that time period for both Medicaid and all payers, and that was a surprise. Another surprise was wanting to have documentation showing how our various drug allergy alerts, drug alerts actually triggered during the time period, and we had not prepared for that in advance, and so we did have to jump in with an IT team to produce that. I think a lot of us in the industry were concerned about how seriously they were going to take the quality metrics. In other words, how much were they going to compare our quality metrics to what we were already reporting to CMS and looking for discrepancies. And really there wasn't any discussion at all about the quality metrics, other than we produce them, but nothing about the quality of the quality metrics, shall we say. Yes, when you are in your full year attestation period, year 2 or year 3 of meaningful use, you need to be on a certified, compliant EHR for the year that you're attesting. But you may be preparing for the next year for stage 2, like we are right now, where you need to do an upgrade. So you need to at all times make sure during your 1-year attestation period that you never lapse off of a system that's been certified. And a piece of advice that I'd given this morning is, before you pull the trigger on that upgrade, make sure that you go out to what's called the Ankh Chapel and make sure that that release level that you are about to upgrade to does in fact show as certified for both 2011 and 2014. As meaningful use goes, so do the audits, meaning that if you miss one measure, one metric, and it's found that you weren't actually compliant on that, then it's game over. You are not compliant with meaningful use, and if you had received money, you have a chance to appeal, but you will have to give the money back. So and as I've always said going into this, before anybody started attesting, is don't just think you know what these measures mean, because you have to be 100% sure that you can defend your position when an audit comes around, and you really need to study the interpretations.